a disc herniation that was discussed with a patient after an accident. So this follows along a lot of the previous videos I've been doing on disc herniations after an accident. And what we tend to see is, you go through the report with people and say, hey, we've got these disc herniations, but you had them probably before the accident, more than likely. You've already been improving. You weren't having pain before the accident. Now you are. So we can't really correlate these things specifically, but they're there, and we're going to keep our plan in place, keep moving forward. Okay. Well, patient's like, okay, that's great, understands, so forth. Then next visit comes around and they tell you, back hurts. Now it must be those disc herniations. And you think to yourself, okay, well, what's changed? And you start having discussion with the patient, and you find out, they basically went to work the next day or went home and talked to some friends who tell them, oh, disc herniations, those are so bad. You're going to have back pain the rest of your life. You're never going to be able to, do this again. You should maybe look at getting a different job. They have these kind of discussions with people. Oh, your uncle had that herniated disc, or that slip disc, as they like to say, and he was never the same. And then he had 3 back surgeries, and now he's in a wheelchair. That people will find someone who's going to tell them every horror story in the book that they can find. And this is not uncommon to to have that happen with a patient you're dealing with after these accidents, where we get these MRI reports, and you have to hold firm with your original discussion with them and say, yeah, I understand you're hearing a lot of things now from some other people. Most of the time you're only going to hear from people that had bad outcomes, and you just need to trust that we're doing the right things. Remember, you were improving so good. You were barely having back pain until you went home and started having these discussions with other people. So you just have to make sure that you help them keep things in context, and you keep moving forward with the care plan. Maybe change a little bit, but for the most part, people need to understand that they're still going to get better. These things are not necessarily a death sentence, and the trap that they fall into is having those discussions outside of your office with other people in their friend group or family group that have heard of disc herniations, and start just telling them horror story after horror story. And it just speaks to that big psychological component of healing and improving after an accident. After we go through these reports, is making sure that to help the person filter out the noise and not get caught up in that trap of thinking, oh, well, I know Dr. So-and-so said, I'm healing, I'm going to be fine, but Jim, my neighbor, told me I'm screwed. And it's difficult to combat that. So you just have to understand that when you're working with these patients, even if they're improving, even if they're feeling better, even if they tell you they're doing better and they're following the plan, they can have one conversation with somebody else outside of your office that puts a little bit of negativity in their head, and you can see symptoms return, and you can see outcomes start to go from positive to negative. So just be aware of that as someone who's working in these situations, and just be prepared, and hopefully this helps you out.